the President of International Medicine Organization of the Pacific, executive members of IMOP, representatives from the Royal Australasian College of Physicians, Dean, College of Medicine, Nursing and Health Sciences, consultants, registrars, and members of the internal medicine profession from Fiji and the Pacific Island countries, visiting specialists from the Apollo Hospital, invited speakers, our keynote speaker, participants, our media partners, ladies and gentlemen, a big Gulavinaka from the beautiful islands of Fiji. Thank you very much, and once again, please allow me to welcome you to this 5th Annual Scientific Conference, and thank you very much to the organizers for the opportunity to officiate at your conference. Going back to what Dr. Malani said, I think there was a deliberate attempt to sabotage the left, and just to make sure that we practice what we preach. So as soon as I left home, my bodyguard said, "Ma'am, the lift is not working." I said, "Which one? My office?" She said, "No, Peninsula." Straight away I said, "Okay, it's fine." So it's always important that we practice what we preach, and many a times saying things is sort of more difficult than doing it. Nevertheless, I think there's a very good start, and I'm sure you've had a very hearty breakfast, and you are all well psyched up for your 2-day conference. Dr. Malani, thank you for the wonderful words. Yes, I do not come from the medical fraternity, but in my short term, I have actually seen, understood a lot about how the health sector operates. Of course, I'm too well aware of the challenges within the health sector, and today's conference, your theme actually effectively tackling disability issues in resource-deprived setting, and I think in the Pacific, when we as leaders in the Pacific meet, when the Pacific health ministers, when we meet, one of the things that we normally talk about is, as mentioned, the rising levels of NCDs, and of course, how do we offer inclusive, barrier-free services to all our people. Just this morning, I was reading on the media monitor, the Minister for Women yesterday launched the standards operational manual for the residential homes, and there she mentioned that we have 1,000 and what was it, Dr. Malani? 1,000. Let me give you the right figure. I don't want the media to quote me wrong. 113,500 Fijians are living with disability, and of course, apart from other welfare assistance, the health sector also needs to be very sensitive to the needs of this high, probably rising number. I mean, this would be just the reported number of people living with disabilities. I'm sure there are many, many more, and we will need to tap up and include them so that they just don't become numbers, but our services are more aligned to the needs of all. And as a government, what we are doing is we are trying to promote, like I said, an inclusive, barrier-free society, and our persons living with disability are part of our society, and we should be actually looking at ways by which we can take them forward, whether it's welfare assistance, whether it's any form. And health, of course, is one of the areas where they need to be looked at more sensitively. I mean, as health professionals, I think it's very important that I would say I'm a health professional now, we are more compassionate and sensitive to the needs of all. And many a times people call me up and say, "Look, I have a 70 or 80-year-old grandmother sitting here waiting in the normal queue to be seen by a doctor." Unfortunately, in the hospital, we don't have a system, but there's something that we are working towards to see how best these people could be served earlier. But on the other hand, I'd like to appeal to the public to also be more sensitive. Many a times, when the family members try to crush the queue and take a disabled member or a very sick elderly member, we have a lot of complaints from the public. And you're aware that in our system here, our lines are pretty big lines, and the waiting times are quite long, maybe 2 hours maximum, 2 to 3 hours max. And it sometimes works on the patience of our people. Everybody who turns up at the hospital wants to be seen as soon as they reach it. Unfortunately, at public hospitals, we look after everybody. So that doesn't happen. Those are some of the realities, and I'm sure you are well versed with that in your own regions, in your own specialties, in your own facilities as well. And we would leave it to you to find solutions to that, because you are a leader in your own selves, and I look forward for you finding some solutions in your own facilities how you can better the service for your people. Nevertheless, ladies and gentlemen, coming back to today, as mentioned, the IMOP was formed about 5 years ago after a period of long planning, compounded by search for funding to establish this organization. And I'm told that with the help of the Support Specialized Clinical Services in the Pacific, program funded by DFET, through the College of Medicine, Nursing and Health Sciences, the Royal Australasian College of Physicians, and of course the Ministry of Health and Medical Services, IMOP was finally established and held its inaugural meeting here in Suva in 2014. I'm sure you're too well aware of the objectives and vision of IMOP, but allow me to just take you through it this morning. One is to promote and represent the practice of internal medicine in the Pacific region. Of course, the second one, to promote ethical principles of internal medicine practice that is applicable to Pacific Island nations and territories, to advance the science and art of internal medicine in the Pacific region through a forum for Pacific Island nations physicians, such as yours, to discuss and comment on matters affecting your practice. And finally, to promote continuing professional development that provides for mutual assistance, exchange of information, continuing medical education, peer review and research in internal medicine, and it aid with selection, education and mentoring of medical practitioners in specialty of internal medicine. As I look across the room, I see a lot of young people, and we look forward for your innovation. I mean, somebody's smiling, nobody's too old. What is age is just a number, eh? So if you think you're too old, no, nobody's ever too old. So if I may at this time say thank you very much for the work that you do, for your people, for your region, and I wish and hope that we advance further through research and collaboration and networking and information sharing to see how best we can find solutions for our people. So thank you very much for the work that you do. And like I say, whatever you do, please do it with a lot of compassion. Medicine is something you can't separate compassion with your work. It has to be there. You need to be sensitive to the needs of your people. Each island nation might have a different set of issues, but I think when it comes to delivery, deliver with compassion. You're dealing with emotions. Every day I receive 10, 20 calls from people who are not happy with the services that the hospitals provide. They're not happy with the attitudes of the medical staff. They're not happy with the way the nurse put the injection in. It was too painful. So it's very sensitive. Your diagnostic, whatever you do, the way you speak with your patient, okay, it sort of makes or breaks them. A loving word, a smile, a tender touch. 2 weeks ago, we had the Chinese ship visiting, piece of art. And a lot of people commented on the human element that was there. You know, as soon as you walked in, the people, the way they spoke to you. When we entered the wards where our people were kept after minor surgeries, you could feel that. So any patient who walks in the hospital, I mean, it is my desire that the people who walk, the nurses, the receptionists, the doctors, the ward assistants, the radiologists, everybody, even the person who does the x-ray, you need to bring that human touch into your service. And I think half the battle would be won. You will gain the trust of your patients. They will open up more to you. And maybe that bonding that should be there between a physician and his patient is something that I'd like improved in my country, definitely. And I'm sure you from other countries, you'd agree with me. So we Pacific people are known to be so hospitable. We are so friendly. But somewhere along the line, I think it's the challenges of your work, the long hours that you do, your frustration sometimes shows on your face, and that smile goes away. So start your day with a smile. Please look after yourself. It's very important that you look after yourself. In trying to serve people, sometimes we forget our own health. I mean, I can say that surely for myself, I forget to eat on time, I forget to take my medicines on time, because we are so much into assisting others. But at the end of the day, our health, our family, our emotions, our well-being, our welfare is also very important. So please continue doing what you do. Look after yourself. Keep that smile up, the Pacific smile. Okay? I know it may not be hard all the time, but do that for the sake of your job. So anyways, I strongly believe that your 2 days conference is a very wonderful platform, not only that allows you to work, but probably allows you to see face-to-face people, hear from learned experts, collaborate, share information, your ideas and experiences, and plan the way forward to strengthen and support positive developments towards the objectives that I've just outlined. It's great to see that the participants for this internal medicine organization of the Pacific includes internal medicine specialists from Fiji and the region, academics, consultants, invited specialists from the Royal Australasian College of Physicians, and other specialists in medicine. This year, the visiting cardiologist and nephrologist and oncologist from Apollo Hospital in India will also be presenting and sharing their experiences with us. I understand that the general practitioners and medical students have also been invited to be part of this conference, which is a very good sign. Ladies and gentlemen, this conference will allow you the opportunity to collectively address key issues faced by physicians and internal medicine specialists in the area of disability in your own home countries. And like I said, I've already mentioned the number of recorded persons with disability in Fiji, and I'm sure you have your own statistics to deal with. I hope the deliberations from the conference will help us effectively understand the magnitude of disability issues in our own countries and communities, and also offer guidance to potential solutions to address these challenges. The educational awareness and training of health professionals to address prevention and treatment of disability will also be an important outcome of your two-day meeting. Ladies and gentlemen, persons living with disabilities are persons with long-term physical, mental, learning, intellectual, and sensory impairment, and whose participation in everyday life as well as enjoyment of human rights are limited, of course, you all know, due to socio-economic, environmental, and attitudinal barriers, if I may add. Fiji ratified the Convention on the Rights of Persons with Disability in June 2017. We have committed to align all national legislations with the provisions of the CRPD. Fiji has a Rights for Persons with Disability Act, which was endorsed by Parliament on 12th March 2018 and came into effect on 21st March 2018. This act, ladies and gentlemen, upholds the rights of persons of disabilities in terms of accessibility to transport, public buildings and recreational facilities, education, health, equal employment opportunities, and other privileges like any other citizen. The increasing incidence of heart and cardiovascular diseases, diabetes, mellitus, and complications such as lower limb amputations and blindness, road accidents, kidney diseases, increases the overall incidence of disability for our population here in Fiji. Of course, this is apart from the congenital disabilities. And unless and until we effectively address the prevention of NCDs, we will continue to see a rise in disability related to NCDs in the future in all our Pacific regions. With this rise in disability, the nations will need to respond accordingly by increasing its specialized health workforce to work in the area of rehabilitation medicine. I understand that our training institutions will work with its partners to develop programs that equip our health workforce in future to meet disability and health needs of the disabled population. Ladies and gentlemen, it is also very important to note that there is a relationship between poverty and disability. Disability adds to the risk of poverty, and conditions of poverty adds to the risk of disability. Disability-related health care is associated with adverse psychological well-being and added burden to close relatives. In a study in Fiji, published in 2001 by Singh et al., it was noted that 2/3 of the spinal cord paralysis caregivers were women, and they were spouses of the patients. So on average, the caregivers spend between 6 to 10 hours per day assisting with activities of daily living. There is so much more that can be done to increase opportunities of empowerment and support services for those living with disabilities, and particularly in areas of education and employment opportunities. And that requires a collaborative approach between government, non-government organizations, the corporate sector, faith-based organizations, the civil society, educational institutions, professional organizations like the Internal Medicine Organization of the Pacific, and of course our communities at large to advocate for inclusivity and empowerment of the rights of peoples living with disability. Currently, the Fijian government through the Ministry of Social Welfare has programs in place to reach out and assist those persons living with disabilities. This includes a $90 monthly disability allowance, free bus fare and taxi fare concession scheme, and along with the annual grants provided to the Fiji National Council for Persons Living with Disabilities to develop the skills and capacity building opportunities for people living with disabilities to earn and live an independent life. Of course, ladies and gentlemen, I'm sure there's more that can be done. The overall total health budget for 2018-2019 for the Ministry of Health is 335 million. Of course, we got an increase of about 14 million, which includes national health programs for the development of families and, of course, inclusive of persons living with disabilities and the health development at the forefront. We are committed at a government level to have a barrier-free society in Fiji through legislations which provides equal rights to all men and women with disabilities, and we are working with all linked ministries and agencies to see that all Fijians are recognized and respected. At this commitment, our commitment here is enshrined in our country's constitution that builds on the central principle of common and equal citizenry. Especially section 42(1)(a, I quote, "A person with any disability has the right to reasonable access to all places, public transport and information," unquote. Ladies and gentlemen, all children, women and men with disabilities have fundamental human rights, and that is an inherent component of economic growth and development. The current government is determined to build a Fiji where there is respect for all people by dismantling barriers and building institutions and structures that are inclusive and allows all people to participate fully and equally. Our government values the skills of our people with disabilities, and to guarantee that they are included with the rest of the Fijian population, will keep on making spaces for all to have a barrier-free society. I'm glad that your theme today is very relevant, such as disability being brought to the forefront of health professional discussion today. I congratulate you, all of you, for this timely thought and wish you well in the next 2 days of your conference. We are thankful to all our sponsors, namely the Secretariat of the Pacific Community being the major sponsor, other sponsors, the Pacific Open Learning Health Network, Muckens Drug Company, and anybody and everybody else who has contributed towards making this conference a reality. Ladies and gentlemen, to all those who have traveled from the other regions and across the globe to be in Fiji, leaving your homes, welcome once again. And while you talk about health issues, I hope you will find time to enjoy our unique cultures and environment. Should you go overboard with our hospitality, our traditional foods, rich traditional foods, sure, you can take a dip in the pool or take a walk across the seawall to burn off those extra calories. And so thank you very much for having me once again, and I look forward to the outcomes of your deliberations, as I believe the discussions that you'll have, the addresses, the presentations that will be held during the 2 days will of course be very, very, very beneficial, not only to Fiji, but to the other Pacific regions as well. And please do share the outcomes with us so that we can also see how best our collaborations can take us forward in terms of effectively tackling issues related to our persons living with disability. So on that note, welcome once again, and thank you very much.
Ardently worked behind the scene for this program. We ask in your name, Lord, to undertake for this 2 days program. Fill us with the knowledge that is imparted to us. Let us not be complacent, but in everything we acknowledge you, that you are the author and the giver.